Stress is a part of life, but what happens when stress becomes chronic? Today, we'll explore how prolonged stress can wreak havoc on our body and mind. When we encounter stress, our body responds by releasing hormones like cortisol and adrenaline. These hormones are essential for our fight or flight response. But when continuously released due to chronic stress, they can lead to detrimental effects on our health. The constant presence of these stress hormones disrupts normal bodily functions, causing various health complications. By understanding these impacts, we can better appreciate the importance of managing stress effectively. The human body relies on a delicate balance of hormones to function correctly. When we experience stress, the hypothalamus signals the adrenal glands to release cortisol and adrenaline. These hormones prepare our body to respond to immediate threats by increasing heart rate, blood pressure, and energy supplies. However, in the case of chronic stress, this emergency response system remains activated for extended periods. Elevated levels of cortisol can disrupt almost every bodily function, leading to issues such as impaired cognitive performance and decreased bone density. Understanding the role of these stress hormones is crucial to recognizing how chronic stress can lead to long-term health problems. Chronic stress can impact our weight, causing either gain or loss. Elevated cortisol levels increase cravings for high-fat, high-sugar foods. Conversely, some may lose weight due to suppressed appetite. Stress affects metabolism, highlighting the complex relationship. Recognizing these patterns helps manage stress-related weight changes. Chronic stress can play a significant role in the development of diabetes. Elevated cortisol levels can lead to increased blood sugar levels by promoting gluconeogenesis, the process where the liver produces glucose. Over time, this can result in insulin resistance, where the body's cells become less responsive to insulin, leading to higher blood sugar levels. This persistent elevation in blood sugar levels can eventually cause type 2 diabetes. Stress-induced behaviors such as poor diet, lack of exercise, and disrupted sleep patterns further exacerbate the risk of developing diabetes. This knowledge underscores the importance of managing stress to prevent long-term health complications. Chronic stress impacts sleep. Elevated cortisol interferes with the sleep-wake cycle. This leads to insomnia and restless nights. Poor sleep worsens stress, creating a vicious cycle. This affects health, cognitive function, and immunity. Addressing sleep issues is crucial for well-being. Chronic stress can take a significant toll on our emotional well-being, leading to anger and mood changes. The constant activation of the stress response system can result in heightened irritability, frustration, and anger. Individuals may find themselves reacting more intensely to minor stressors, leading to conflicts in personal and professional relationships. Chronic stress can contribute to mood disorders such as anxiety and depression. The prolonged release of stress hormones can alter brain chemistry, affecting neurotransmitters like serotonin and dopamine, which play a crucial role in regulating mood. Recognizing these changes is essential for seeking support and implementing stress management strategies to improve emotional well-being. Chronic stress can also affect reproductive health in both men and women. In women, elevated cortisol levels can disrupt the menstrual cycle, leading to irregular periods or even amenorrhea, the absence of menstruation. Stress can also affect fertility by interfering with the release of reproductive hormones necessary for ovulation. In men, chronic stress can lead to decreased testosterone levels, affecting libido and sperm production. Stress-induced behaviors such as smoking, alcohol consumption, and poor diet can further impact reproductive health. Recognizing these impacts is crucial for addressing stress-related reproductive issues and seeking appropriate medical guidance. Chronic stress can have a detrimental effect on bone health. Elevated cortisol levels can interfere with the body's ability to absorb calcium, leading to decreased bone density and an increased risk of osteoporosis. This condition makes bones more fragile and prone to fractures. Chronic stress can lead to behaviors that further impact bone health, such as poor nutrition and lack of physical activity. Visualizing bones becoming brittle over time helps us understand the long-term impact of chronic stress on bone health. Recognizing these risks is essential for adopting lifestyle changes that support bone health, such as a balanced diet, regular exercise, and stress management techniques. Chronic stress can have a profound impact on mental health, contributing to conditions such as anxiety and depression. The constant activation of the stress response system can alter brain function and structure, affecting areas involved in mood regulation, memory, and decision-making. Prolonged exposure to stress hormones can lead to changes in brain chemistry, reducing the levels of neurotransmitters like serotonin and dopamine. This can result in symptoms of anxiety, such as excessive worry, restlessness, and panic attacks. It can also lead to depression, characterized by persistent feelings of sadness and hopelessness. Recognizing these effects is crucial for seeking appropriate support and implementing stress management strategies to improve mental well-being. Chronic stress can contribute to the development of hypertension, commonly known as high blood pressure. Elevated cortisol levels can cause blood vessels to constrict and increase heart rate, leading to higher blood pressure. Over time, this can damage the blood vessels and increase the risk of cardiovascular diseases. Stress-induced behaviors such as poor diet, lack of physical activity, and smoking can further contribute to hypertension. Visualizing a blood pressure monitor showing elevated readings helps us understand how chronic stress can lead to hypertension. Recognizing these risks is essential for adopting lifestyle changes that support cardiovascular health, such as a balanced diet, regular exercise, and stress management techniques. Chronic stress can significantly impact heart health, contributing to the development of coronary artery disease, or CAD. Elevated cortisol levels can lead to inflammation and the buildup of plaque in the arteries, narrowing them and reducing blood flow to the heart. This can increase the risk of heart attacks and other cardiovascular events. Stress-induced behaviors such as poor diet, lack of exercise, and smoking can further exacerbate the risk of CAD. Recognizing these risks is essential for adopting lifestyle changes that support heart health, such as a balanced diet, regular exercise, and stress management techniques. Chronic stress can also play a role in the development of cancer. Prolonged exposure to stress hormones can weaken the immune system, reducing its ability to detect and destroy cancer cells. Recognizing these risks is essential for adopting lifestyle changes that support overall health and reduce the risk of cancer, such as a balanced diet, regular exercise, and stress management techniques. Chronic stress can also affect the musculoskeletal system, leading to muscle tension and joint pain. Elevated cortisol levels can cause muscles to contract, leading to tension and discomfort. Over time, this can result in chronic pain conditions such as tension headaches, neck pain, and back pain. Stress-induced behaviors such as poor posture and lack of physical activity can further contribute to musculoskeletal problems. Visualizing muscle tension and joint pain helps us understand how chronic stress can affect the musculoskeletal system. Chronic stress can also impact liver health, leading to conditions such as liver inflammation and fatty liver disease. Elevated cortisol levels can cause the liver to produce more glucose, leading to increased fat accumulation in the liver. Over time, this can result in liver inflammation and damage. Stress-induced behaviors such as poor diet and alcohol consumption can further contribute to liver disease. Visualizing liver inflammation and fatty liver progression helps us understand how chronic stress can affect liver health. Chronic stress can also play a role in the development of autoimmune diseases. Elevated cortisol levels can disrupt the immune system, leading to an overactive immune response that attacks healthy cells. This can result in autoimmune conditions such as rheumatoid arthritis, lupus, and multiple sclerosis. Stress-induced behaviors such as poor diet and smoking can further exacerbate the risk of autoimmune diseases. Visualizing the immune system attacking healthy cells helps us understand how chronic stress can contribute to autoimmune diseases. Chronic stress profoundly impacts our health. Managing stress with mindfulness, exercise, healthy eating, and adequate sleep is crucial. It's not just about feeling better, it's about long-term health. Engage in yoga, meditation, and nature activities. Reduce chronic stress and improve well-being. Thank you for watching, and don't forget to subscribe for more health insights.